coming to the question regarding the Brahmi, there was this question that isn't Brahmi being cold or Shita Virya little drying? And what is the best Anupana or codering for Brahmi when we are giving it to someone who has severe Vata related disorders, dry skin, dry sores, or maybe memory loss, again Vata related disorder? Your thoughts on that?
No, we need to understand certain things. There are peculiar way a drug behaves in the body. Brahmi is having multiple roles, but still, out of those important functions, there are very much sharp and very much pronounced functions will be there for certain things. Not everything will be addressed by a thing. If see, for example, whenever we read, most of the drugs we say it is Agnivardhaka, it is Deepana, Pachana. But we don't use all those drugs for the purpose of Deepana Pachana. Whenever we want to have a Deepana Pachana, we typically select Chitraka. We typically select Trikatu. There are drugs which are Jiraka, which is very specific for the Deepana Pachana. That purpose only we will select. Similarly, whenever there is a Vata Vardhana is there and we need to reduce the Vata, then we need to understand first basically where these things are there. Whether it is at the level of skin or whether it is at the level of Pranavashrotas or whether it is at the level of Mahashrotas. So that has to be taken care whether where exactly things are there and which Vata, which site is very, very important. If you understand this, what is the site, where it is happening, then accordingly, for say in this case of Brahmi, so Brahmi, you want to give it in a patient of a Vataja condition and where there is a memory loss and all those things, being Shita and all these things, how can we go for it? It's the best combination for Brahmi. It has to be given, then it is better give it in the form of Gritha. Brahmi Gritha is the best format because Brahmi Gritha has the special capacity to pass through the blood-brain barrier. So that is the reason we use it Brahmi Grita. That's a very good one. And when we want to have a Rasayana effect, better it is in the form of Swarasa. So very clearly Acharyas have very clearly mentioned in what way it should be used. Manduka Parni should be in the Swarasa format. Shankapushpi is in the Kalka format. Estimadu is in Churna. Guduchi is in Churna. So all these things very clearly the Acharyas have explained for what purpose, what should be used and how it should be used. So if you want to use your information or to customize the procedures or a protocol to a patient and according to the needs of the patient, then of course think on those lines of Samanya Vihi Siddhanta. What are the lakshanas of the patient? And you anticipate that lakshana is produced due to which dosha, and then at the level Vektasthana you identify it, then accordingly where what should be used. If it is a dryness in the skin, then why you want to go for a Brahmi? You can straight away go for some Grita application, Shatadota Grita onto the skin, or Karanjataila applied, or coconut oil applied onto the skin. So like that, where exactly the things are happening, accordingly we need to go for thing. Wherever it is a locally manageable, then you apply it, do it locally. There are one who is lean, thin and is ruksha and even body mass is lost and everything. Then such a person requires a Vatahara Dravya or a Kapha Dravya from the core inside. So then we need to go for some Agni Vardhana, Deepana Pachana Dravyas. Along with that, then Brahmana Karma should be done, initiated from the internally. Not by simply applying oil from outside won't do any good thing here. So we need to do that. And sometimes even if the skin is also ruksha, along with that is lean and thin, then you can go for both internally as well as externally snehana. So internally also we can go for this snehana with Gritapana and all those things. Then externally also we can go for Abhyanga with Taila and all those things. So like this you need to plan according to the requirement. Each and every patient will be a different set of combination, will be a different type of doshic imbalance, then accordingly we need to address it. So it is very typically based on the requirement, whatever the requirement, whether it is at the level of skin, Vektasthana is in the skin, then accordingly do it at the level of skin locally. If it is internally, any tissues involved, entire whole body mass is less, is a weak, lean and thin, then go for the Brahmana Karma inside and reduce the Vata. So that is the reason we need to understand.
Yes, and going by the question, we should not fixate on the herb and then think about the disease. We should be thinking about the disease first and then go for the herbs based on the site of pathology, like what you have said, sir.
See, very clearly, Ayurveda says, Rogamadam parikshetam tadanantaram aushadam. First, Roga has to be identified. Then, what drug should be given or what protocol should be fixed for this, that has to be concept. Then, concept after that, exactly for this particular case, XYZ, what should be done? That has to be done. So, we need to understand that very clearly. First, identify the disease, diagnose it. You may be having very close diagnosis, maybe probable diagnosis or provincial diagnosis. Okay, no issues. You do it that one, then go for the sadhya sadhyata assessment. Then you try to give a medicine. Then once the medicine you start using it, then protocol, whatever the thing, whether shodhana is required or whether even shamana is itself is enough. All these things you can straight away understand the things and you can use the protocols as per the requirement. But beginning with identification of disease. Rogamado parikshetam tadanantaram aushadam. So aushada comes in the last.
Yeah, I mean, the brilliant, right point, right, Shloka. Thank you so much, sir.